Alive and Well is brought to you by Pine Rest Christian Mental Health Services.
This segment is sponsored by Pine Rest. Because of the uncertainty, the traumatic news, and the life changes we're experiencing, for a lot of folks, anxiety is high right now. Megan Zambiasi from Pine Rest is with us today to talk about how you can get help at the Pine Rest Psychiatric Urgent Care Center for yourself or for a loved one. And it is good to see you, Megan. Thanks so much for joining us.
Yeah, thank you, Catherine, it's great to be here.
The truth is that a lot of people are suffering right now. They're worried about, getting sick. They're worried about loved ones, how they're going to make it through this stay-at-home period. There's a lot that's bothering people, and it's kind of displaying itself in a variety of ways, right?
Right, absolutely. I think this has been a really difficult time for everyone. No one has ever experienced this sort of thing before, and many of us are having symptoms of anxiety or worry or sadness, depression. So yeah, absolutely. People are still experiencing those things, probably even more than they were previously.
Or maybe intensely, or because it's also new for all of us. It's just
Right,
strange. Now,
right.
your urgent care is open as normal, right?
Right, absolutely. We decided it was really important to stay open and to have the same hours available to people as we had previously. We really want to be that resource for the community. So we are open and ready to help.
And tell me a little bit about what you're doing to be sure that patients and staff are being kept safe in these circumstances.
Yeah, we adjusted some of our practices, from previously, like everybody else has. So as you come in the front, we have a little station there with hand sanitizer and masks available. We are asking that people mask up as they come in. We also are asking just to have one support person, just to keep the number of people in our facility down, so that we can have good social distancing in our waiting areas and all of those things. Our staff are also masked up, so if we believe that masks and all those things work, which we do, then if we have masks on and you have a mask on, then we're doing pretty well to keep each other safe and also do the social distancing thing whenever we can. So those things are available. We're also using additional cleaning supplies and all those things. As a hospital, we've always done that, but we've been doing that a little more even than we previously did, just to be sure that those spaces are safe. And actually, as you walk into one of our treatment rooms, we have little note cards there just to let you know that somebody recently sanitized it to make you feel a little extra comfortable.
This may be a first visit for a lot of people, and they could have questions about insurance coverage, that sort of thing. You encourage them to call before they come, or can those things be worked out, at the door, as they say?
Yeah, if you have questions, we always encourage you to come, to give us a call. We're happy to walk you through that, especially if you think perhaps you have insurance from an out-of-state employer, for instance, or something, and you're just not sure about that. We're happy to walk through that with you over the phone. But if you arrive, we'll help you work that out here too. We do that all the time and are very accustomed to that.
I understand you have fewer people coming in right now. Tell me a little bit about what you think is causing that.
Yeah, I think we've seen our volumes dip down a little bit lower, which is pretty typical right now. We're actually hearing that from across the country, that we're finding that people are reticent to seek help. I think their fear is that it'll be crowded when they get someplace, so they're worried about the distancing pieces, just in general, and so healthcare is no exception. But for that reason, we actually really encourage you, if you are needing help, that you reach out and get that help that you need right now. Healthcare facilities, ours included, are actually really safe places to be right now, because we're taking all of those extra steps and we're screening everybody as they come in the door, including our staff.
Yeah. The good news is that folks have discovered you. You're celebrating your 1-year anniversary. You've served some 6,600 people.
Right.
That is a real stamp of approval. What you're doing is what was needed in our community, right?
Right, absolutely. We feel really good about that. I mean, it's difficult to celebrate during a pandemic, right? But we actually passed our 1-year mark on April 15, and it was really great for the team to look back and see just how many people we've been able to serve in the first year. So we're really excited about that, and we're glad to be a resource for the community. We're just hoping that that continues to grow over the next year or two.
Yeah. Well, congratulations, and thank you, Megan, for the work that you're doing at Pine Rest. It's so important right now and always. So I
Yeah,
appreciate your taking time to spend with us.
of course. Thanks so much, Catherine. Take care.
Yes, and if folks want to learn more about what's going on at Pine Rest, you may do so on their website. We've put a link to it on ours, so go to 13onyourside.com. You'll find it there.